talk about some of those changes that happen in late pregnancy and some of the early labor signs or signs that your body might be gearing up to start labor. So, toward the end of pregnancy, it's not uncommon to have low back pain, some pelvic pain. Sometimes you'll have some swelling in your feet as well. Now, swelling alone isn't a concern unless it's a really dramatic overnight, like your feet, your hands, your face. You wake up and you go look in the mirror and you're like, oh my gosh, what's going on? However, if you have that extreme shift or a headache that doesn't go with Tylenol, blurred vision, right upper abdominal pain, that's one reason you definitely want to go in and get checked out. We're concerned about preeclampsia if you're experiencing, more than one of those symptoms. And on anytime you're concerned about symptoms you're having, make sure you call your doctor's office. They always have an on-call provider, and that on-call provider will call you back if you happen to call after hours. They'll call you back, they'll get more information, and they'll advise you what's the best thing to do from your situation. Other things that are concerning is if you feel a change in your baby's movement. There's a misinformation out there that says that the babies are not moving as much toward the end of pregnancy, and that's not accurate. One of my favorite ways to encourage people to monitor their baby is Count the Kicks app. And it's an app that you can download. You turn off your TV, all your entertainment, and you have a nice snack, lay down, and you lay on your side, place your hand on your belly, and you count how long it takes your baby to do 10 movements. Now, every baby is different, actually. Some babies move 10 movements within the first 5 minutes and they're done. Great. You don't have to keep monitoring. But if you notice your baby's not moving the way that's normal for your baby and you're worried, it's always best to go in and get checked out, because we normally say 10 movements in 2 hours. But if your baby's having a shift in their movement for that particular time of day, that's concerning. And so with the Count the Kicks app, we always want you to be checking about the same time of day, because you already noticed that your baby has different movement, active periods and sleep periods, right? So make sure you monitor about the same time each day. Other things you definitely want to be bringing up to your provider are things like itchiness. If you're dealing with a lot of itchiness, especially in your hands and feet, that's a little bit concerning, and they'll want to do some blood tests to see if you have something called cholestasis. If you do have cholestasis, they're going to monitor you quite closely during your pregnancy. Because of the risks of stillbirth with that, they want to monitor your levels to make sure they're not getting too high. If they do start to climb, they're going to want to induce you sooner rather than later. Other changes that can happen, some people talk about the baby dropping. So some people carry the baby kind of high and you feel like you can't breathe very well. You don't have much room to eat. Your stomach's just all squished up in there. And so once the baby drops, that's also called lightening. The baby goes down a little further in the pelvis. You feel like you can finally breathe again. You also feel like you could finally eat almost a whole meal. But you do have to pee an awful lot once the baby does drop. Now, there's no significant information that the baby dropping gives us. Some babies drop sooner, some drop later, and it has no indication on when you're going to go into labor. As a matter of fact, some moms who've delivered before don't drop until they're in labor, and that's fine. So let's talk about some of those things that can tell us maybe labor might be starting. So we've talked about the mucus plug before. Some people will lose their mucus plug when their body's preparing to go into labor. Although if you lose it early, remember it can regenerate. So it in itself isn't enough of a thing to tell us, hey, this is it. Some people will start to do what's called nesting, meaning you'll be wanting to do all sorts of things like rewash all the baby's clothes or organize your kitchen cabinets or sort through your closet. You'll just be doing different things to get your home ready. Some people will lose a little bit of weight, like 1 to 3 pounds. Others will start to have really loose stools, not diarrhea loose, but way more loose than normal for you. And all of those things can tell us labor might be starting to creep up. And low back pain too, that's kind of coming and going, might tell us your body's revving up for the labor process.